If you're above 60, there's one activity you perform each and every night that might subtly elevate your chance of experiencing a stroke, all without any discomfort, without any alert as you rest. No heart discomfort, no mumbled words, no lightheadedness to warn you. You retire to sleep feeling perfectly okay. And come morning, things have shifted. You arise disoriented, struggling to express yourself clearly, or perhaps you can't raise your arm. It's a stroke, stealthy, abrupt, and profoundly transformative, all due to something as straightforward as your sleeping method. As a physician specializing in the brain, I've witnessed this scenario all too often, and not due to tobacco use or unhealthy eating or insufficient physical activity, but owing to everyday sleeping practices that the majority of elderly individuals consider harmless. They aren't. Today, I'll guide you through 9 hazardous sleeping postures and evening rituals that could be heightening your stroke risk, cerebral hemorrhages, or surges in blood pressure, particularly during those serene nighttime periods when your brain is especially susceptible. If you or a loved one is past 60, this video might preserve a life, possibly even your own. So, stay engaged. Let's get started. Prior to jumping in, if you haven't subscribed already, I suggest you click that button and activate the notification bell so you won't overlook any future health advice tailored specifically for you. If this video appeals to you, enter the number 1 in the comments. If it doesn't, enter 0 to inform me on how I can improve the content for you. 1. Sleeping flat on your back without any pillow. Sleeping flat on your back with no pillow. Supine head level. It appears innocuous, even soothing, resting completely flat on your back during the night, with arms positioned at your sides. No cushion beneath your head. For numerous seniors, it's a practice that dates back many years. Some claim it alleviates back discomfort. Others believe it expands the chest area, but here's the detail that scarcely anyone shares with you. Reposing flat on your back, sans head elevation, can covertly boost your stroke likelihood during the night, and you may never sense its approach. When you lie entirely flat, your head aligns at the same height as your heart. That may seem instinctive, but from a physiological standpoint, it's not. Particularly not for those advancing in years. You see, with advancing age, the blood vessels in our neck and brain diminish in elasticity. Blood circulation becomes less effective. The veins designed to remove blood from your brain now have to battle gravity. Consequently, rather than flowing out effortlessly, blood can lag, decelerate, and potentially coagulate, above all in the initial morning hours when blood pressure inherently increases. And once blood clots develop while sleeping, they won't remain dormant indefinitely. A single minor clot within a constricted vessel, and the outcomes can be catastrophic. Mumbled speech, sagging face, lasting impairment, even fatality. I want to share the story of Mr. Leonard Whitaker, a 77-year-old former mechanic from Michigan. Robust, self-reliant, he still repaired lawnmowers in his workshop. Each night, he reclined flat on the bed, no pillow, merely the mattress and his hands clasped across his chest. A custom he adopted from his time in the Navy. He mentioned it aided deep slumber. One morning, his wife Mary discovered him partially conscious yet speechless. His eyes were wide, but one side of his face had drooped. He was unable to raise his right arm. In the emergency room, an imaging scan indicated a clot in his left middle cerebral artery, a form of ischemic stroke that occurs when blood densifies and coagulates within constricted vessels, frequently overnight. His carotid arteries were rigid. Blood had lingered excessively, and it all connected to his sleeping posture. The medical team acted swiftly to break down the clot, but Leonard was altered forever. His speech is now more deliberate. He relies on a walker. And each evening, Mary meticulously positions him with a wedge pillow, an item they both regret not discovering sooner. What the majority of individuals fail to grasp is that lying flat, particularly amid age-associated vascular alterations, impairs venous drainage from the brain. That's the clinical term for it. Your brain's drainage network decelerates, and pooled blood can foster an environment for clots. Factor in typical overnight fluid loss and reduced oxygen levels, and you have an ideal condition for trouble. This posture poses particular threats for elderly people with hypertension, atrial fibrillation, sleep apnea, prior carotid artery issues, or those using blood pressure drugs that lower pressure excessively at night. The most secure modification is a minor elevation of the head, around 30 degrees. It enables gravity to aid blood movement, lessens intracranial pressure, and promotes more uniform brain oxygenation. Even a couple of supportive pillows can yield a significant impact. And always select a pillow that maintains the neck's natural arch, not one that pushes the chin ahead. Certain folks believe this concerns mere ease. It doesn't. It's regarding circulation to your body's most sensitive organ. It's concerning safeguarding your autonomy, your recollection, your capacity to communicate, to ambulate, to remain yourself. Leonard once confided in me, with moisture in his eyes, "Doc, if only someone had warned me that flat sleeping could cause this, I would have altered it long ago." Allow me to serve as that someone for you right now. But if that strikes you as worrisome, hold on until you discover what occurs when you sleep prone, with your neck twisting in an improper manner, obstructing the precise arteries that nourish your brain. If you're continuing to watch and deem these revelations useful, kindly post the number 1 in the comments to indicate you're following along. Now, let's proceed to the second point. 2. Sleeping face down, prone position. Sleeping face down, a subtle error that numerous elderly individuals commit nightly, exists. One that seems reassuring, accustomed, and even benign. Sleeping on your stomach. Perhaps you began this to relieve backache. Maybe you appreciate the sensation on your chest or how it envelops you like a secure cocoon. But I'm here to inform you of something your general practitioner might never have mentioned. Reposing face down can rank among the riskiest stances for your brain. Medically, it's termed the prone position. In more youthful physiques, it may not inflict substantial damage, but as years accumulate, our blood flow diminishes, our arteries rigidify, and our oxygen concentrations decline more readily, particularly in profound sleep phases. When you repose face down, multiple perilous events commence. Your neck rotates acutely to one side for breathing. This stance squeezes the vertebral arteries, which transport oxygen-laden blood from your spine to the brain's rear, an area managing equilibrium, synchronization, and even consciousness maintenance. But that's merely the beginning. This configuration also exerts force on the carotid arteries, particularly as your head embeds into a plush pillow or bed. Circulation decelerates. Veins intended to transport blood from the brain get twisted. Stagnant blood accumulates, densifies, and in susceptible individuals, it generates clots. Such clots can linger undetected for hours, awaiting the morning blood pressure escalation, which may release them and propel them straight to the brain. The outcome? A stroke, frequently extensive, occasionally lethal. I'll always remember Mrs. Ethel Lawson, an 82-year-old former school teacher from Ohio. She consulted me following a frightening incident. Her daughter had located her one morning awkwardly prone, her speech muddled and her left side inert. Ethel was hurried to the facility where scans displayed a substantial ischemic stroke impacting her cerebellum, the brain section overseeing coordination and stability. Yet the origin wasn't elevated cholesterol or atrial fibrillation. Ethel's carotid arteries had constricted with age, and the prolonged periods she spent sleeping face down with a twisted neck had diminished blood flow sufficiently to permit clot development. By dawn, the harm was inflicted. Ethel endured, but she ceased driving. She has trouble walking sans a walker, and she confides in me at each visit, "I was unaware that something so basic as my sleeping manner could almost end my life." Allow me to explain the underlying science. In the prone stance, neck twisting can hinder vertebral artery circulation by over 40%, particularly if the cushion or surface propels your head rearward. Chest squeezing can limit lung capacity, resulting in diminished oxygen levels, which adds strain to your heart and brain. Blocked airflow can elevate carbon dioxide buildup, which additionally disrupts brain circulation, often causing vascular unsteadiness. As we grow older, we no longer handle oxygen reductions as before. Our physiological reaction speed slows. A person in their 30s might rouse gasping and reposition. But at 70 or 80, the identical oxygen decline might go undetected, covertly preparing for a nocturnal stroke. And if you snore, suffer from sleep apnea, or use sedatives or sleep aids, face-down sleeping amplifies the peril. Your physique responds less, your airway is prone to closure, and the probability of an undetected oxygen-deprived stroke escalates. If you or a loved one tends to sleep stomach down, I strongly encourage attempting a switch to side lying with a solid pillow maintaining head alignment. Or ideally, repose mildly elevated on your left side to safeguard both cerebral and cardiac flow. These minor alterations aren't solely for ease. They concern endurance, because what seems snug might be applying fatal compression to the exact arteries sustaining your brain's vitality. And recall, it's not solely about your sleeping posture. It's also about where tension accumulates during rest. Because next, we'll discuss a sleeping practice that countless seniors adopt, particularly those with hip or shoulder discomfort, that subtly halts blood circulation and results in abrupt nocturnal strokes. And it occurs on your preferred side. 3. Sleeping with a heavy blanket over the head. Sleeping with a heavy blanket over the head. A minor, intimately personal custom that many elderly retain into later years exists. Something reassuring, nearly infantile, that we perform thoughtlessly. We draw the blanket upward over our heads at night. Perhaps it's to muffle sounds from a snoring spouse or a whirring fan. Maybe the space feels chilly or overly illuminated. Or perhaps, like those raised in cooler dwellings, we derive a sense of tranquility beneath that enveloping warmth and quiet. But for seniors, this unassuming evening custom can covertly become fatal. When you repose with a substantial blanket covering your head, you're not merely obstructing light or noise, you're constraining airflow. Across the night, oxygen concentrations diminish within that confined area. Carbon dioxide, the expelled waste gas, accumulates near your nose and mouth. And although your youthful form may have endured it years back, at 60, 70, or 80, your brain no longer rebounds identically. Reduced oxygen and elevated carbon dioxide overnight heighten your blood's coagulation tendency, and in fragile brains, it generates clots. Permit me to recount Mr. Richard Hale, an 81-year-old former postmaster from Iowa. A serene, reflective individual, Richard favored the sensation of darkness during sleep. He shared he'd been drawing covers over his head since youth. Mostly, in colder seasons, his wife had playfully ribbed him, noting he resembled a swaddled caterpillar nightly. But it rendered him secure, at ease, and thus each night he settled snugly, drawing a dense quilt over his head and coiling into repose. Then one morning, Richard remained in bed. His wife, concerned, discovered him lethargic and non-responsive. He could hardly part his eyelids. Upon ambulance arrival, his blood oxygen was perilously low, and hospital imaging unveiled a covert stroke in the early morning. A clot had developed and embedded in a minor vessel deep within his brain, not from atherosclerosis or atrial fibrillation, but from sleep-induced oxygen shortage coupled with age-linked blood densification. And indeed, one contributing factor: sleeping with impeded airflow beneath a heavy blanket. You see, in profound sleep, particularly REM cycles, your brain requires steady oxygen supply. When under covers re-inhaling used air, oxygen falls, your heart accelerates compensatorily, and blood pressure starts varying. These elevations and dips stress vulnerable vessels, include slight fluid loss, sluggish movement, and age-stiffened arteries, and you've established an optimal clot scenario. And here's the alarming aspect: you might remain oblivious. You retire feeling cozy and protected, but your brain is gradually asphyxiating, and once the injury occurs, you may arise transformed, if you arise. Research indicates that even slight hypoxia, lowered oxygen during sleep, correlates with markedly heightened stroke and cognitive deterioration risk in the elderly. And this peril isn't exclusive to diagnosed sleep apnea sufferers. It can impact anyone whose respiration is disturbed by surroundings or stance. If you repose with a blanket over your head, even merely in winter, it's moment to reassess the pattern. Rather than drawing covers up, consider a sleep mask for light blockage or earplugs for noise. Maintain your room at a pleasant, warm level and opt for airy, light bedding. This concerns not unease. It's regarding safeguarding, providing your brain the oxygen essential for renewal, mending, and enduring the night. Because strokes don't solely befall others. They befall decent people, considerate people. Individuals like Richard, who never suspected an enduring custom could nearly rob his capacity to ambulate, converse, and recall. He now reposes with a wedge pillow, gentle illumination, and his blanket positioned below his shoulders. He confided softly, "I never realized something that seemed so secure could prove so hazardous." And he's far from unique, because ignorance can harm us, particularly during slumber. But as perilous as a heavy blanket over the head might be, it pales against the subsequent custom, one that countless older Americans depend on for solace, yet it could be severing cerebral blood supply. Commencing with how you position your arm beneath your pillow, allow me to demonstrate its occurrence. If you're persisting in viewing and deeming these revelations worthwhile, kindly post number 1 below to confirm your presence. Now, let's advance to point number 4, sleeping upright in a recliner. 4. Sleeping upright in a recliner, common among seniors experiencing back pain. For numerous elderly, slumber grows more challenging with years, not merely initiating sleep, but maintaining it sans ache or unease. Sore joints, rigid backs, reflux, and breathing difficulties all direct to a typical remedy, the recliner. You might recognize someone who's forsaken their bed entirely, or perhaps that individual is yourself. Nightly, recliner repose turns habitual. A plush cover, the TV murmuring softly, the seat tilted perfectly. It seems dependable, but what appears secure can occasionally be covertly perilous. And as a brain specialist, I've observed how this stance, reposing upright in a reclined seat, can gradually, soundlessly amplify stroke risk overnight. You see, the body is engineered to recline flat with uniform blood and oxygen distribution. But in a semi-vertical posture, around 45 to 60 degrees, you're disadvantaging your circulatory network, especially if aged. In this configuration, gravity performs dual actions. It draws blood downward from your brain, and it squeezes principal veins in your legs and pelvis. The outcome? Lethargic circulation, accumulation in the lower extremities, and substantially elevated clot risk. In youthful forms, this isn't as threatening, but post-60, circumstances alter. Blood thickens from age-induced fluid reduction. Vessels constrict from prolonged usage. The heart operates less optimally, and that sluggish blood drawn to your lower regions can generate clots, tiny, adhesive, undetected hazards that might ascend during the night or dawn. All required is one such clot embedding in a cerebral vessel. Harm occurs prior to awakening. Permit me to share Mrs. Barbara Keene's tale. 79, a former florist from Kentucky, a charming lady with keen recall and the kindest grin. She commenced recliner sleeping 5 years prior after hip procedure rendered flat-lying too uneasy. "Merely until the discomfort subsides," she assured herself. But discomfort persisted, and gradually the recliner supplanted her bed. She'd arise rigid but coped until one morning her daughter located her in the seat, bewildered and scarcely able to shift her left hand. She sensed nothing, no alert, yet scans disclosed a lacunar stroke, a minor, profound stroke from a clot in a minuscule brain vessel. She lacked major cardiac issues, no atrial fibrillation. What she possessed was inadequate circulation from extended, upright sleeping. Her legs swelled, her ankles frequently tightened, and each dawn she'd experience vertigo exiting the chair. Retrospectively, indicators existed, but she, like many, never envisioned a recliner could subtly evolve into a stroke snare. Here's the clinical reality. Upright sleeping diminishes the baroreflex efficacy, the innate mechanism for blood pressure control. In horizontal rest, brain and heart interact more seamlessly to equilibrate pressure. But vertically, particularly if leaned forward or mildly contorted, that reflex diminishes, yielding pressure volatility. And in the elderly, this turns hazardous. Include drugs, fluid loss, or squeezing from fitted socks or edema, and you confront numerous risks simultaneously, all while assuming a cozy night's repose. So, if you repose in a recliner or favor naps there, regard this as your alert. Slumber isn't solely repose. It's about orienting your form to shield your brain. If elevation is necessary, employ a medical adjustable bed or sturdy wedge lifting your upper body sans lower limb compression. And ensure to extend and shift legs routinely to bolster flow. Barbara now reposes in a bed anew, with head mildly raised and a body pillow aiding her hip. She frequently shares, I believed I was simplifying matters for myself. I never considered I was complicating them hazardously. Numerous individuals presume peril lies in excessive motion. But for seniors, peril often resides in immobility in an improper stance too long. But if you believe a recliner might sever blood supply, anticipate what ensues when you repose on your favored side with arm trapped under your pillow. It seems innate, reassuring, but it may rank as the most detrimental stance overall. Allow me to clarify the reason. Sleeping on the right side with arm under pillow. 5. Sleeping on the right side with arm under pillow. Most dangerous. A stance that millions discover solace in, particularly elderly. It seems innate. It seems reliable. You recline on your right side, nestle a plush pillow beneath your head, perhaps position another between knees, and instinctively glide your arm underneath. You nod off, assuming it's unchanged from decades past. But as a brain physician, I must inform you this constitutes the riskiest sleeping stance I encounter in seniors. Not for inducing ache, but for covertly limiting cerebral blood supply nightly and potentially elevating stroke risk, precisely when you think you're resting most securely. Let's dissect it. When reclining on your right side, especially with arm jammed under head or pillow, you're applying straight force to key arteries and veins in neck and shoulder, encompassing the carotid artery and subclavian artery. These are vital conduits, routes for blood to and from your brain. But hours of compression slows flow, causes pooling, squeezes veins, constricts arteries, and in Philippe's tranquil immobility, stagnant blood starts densifying. It produces clots. That clot may remain stationary for hours until morning shift. Blood pressure ascends with daybreak. The clot releases. It ascends. And abruptly, your brain lacks oxygen. Permit me to recount Mr. Ellis Randall, a 75-year-old Vietnam vet from North Carolina. Determined, staunchly autonomous, he jested he could still surpass his grandson in speed. Nightly, Ellis reposed on his right side, as since service days. He'd bent his arm under pillow for neck aid. He shared one morning his wife found him partially from bed, stunned and immobile in left leg. He was expedited to ER, where images showed a right hemisphere stroke from clot in middle cerebral artery. But Ellis lacked high cholesterol. He wasn't diabetic. He abstained from smoking. So whence the clot? As we examined habits, it clarified persistent right side pressure plus years of arm undersleeping had impaired vascular movement. Ultrasound indicated carotid narrowing. And from unwittingly curtailing flow nightly for hours, a clot formed undetected in slumber and assaulted pre-dawn. Ellis endured, but mobility diminished. He now ambulates with brace and attends weekly therapy for coordination restoration. He once murmured to me, "I never suspected my sleeping manner could deceive me." Here's the reality. This stance impacts not only arteries, it also squeezes the brachial plexus, a nerve cluster traversing shoulder and arm. When compressed under body weight, nerves don't merely numb, they transmit alarm to brain and can disrupt sleep cycles unnoticed. Gradually, this inadequate circulation and nerve strain may foster microvascular harm, the sort accumulating silently until rupture. Elderly are particularly susceptible as vessels rigidify and constrict with age. Blood viscosifies. Rebound from restricted flow prolongs. Nerve durability wanes. So if you've reposed on right side, especially arm beneath, it's time for adjustment. Not for ease, but to avert life-changing repercussions. Attempt left side switch with head softly elevated and arms positioned ahead or beside body, not below. Employ contoured pillow for neck alignment and vessel pressure reduction. One minor shift may safeguard autonomy, recollection, capacity to embrace family, stroll with pet, or utter grandchild's name. You may not sense the ongoing harm, but brain retains it. Blood flow logs it, and ultimately, body responds. Because sleep time ignorance can alter all upon awakening. But if arm sleeping seems perilous, await discussion on nocturnal tossing and turning, and how agitation itself may signal brain's pre-disaster alert. Allow me to illustrate its meaning. 6. Frequent tossing and turning. Frequent tossing and turning. A form of agitation that creeps in with age exists. The failure to sustain sleep, the repeated arousals, the perpetual switching from side to side. You might attribute it to typical aging, joint inflammation, or restroom needs. But suppose I revealed that this nightly tossing and turning pattern could signal a brain warning, and worse, provoke a stroke. As a neurologist, I've realized sleep serves not just recharging, but as vital period for brain to restore circulation, equilibrate pressure, and eliminate toxins. When repeatedly disrupted, especially in elderly, repercussions can be subtly ruinous. Each sharp bed motion, rolling, head shifting, neck adjusting, briefly modifies brain blood flow. In a robust 30-year-old, it might be inconsequential. But at 70 or 80, with rigid arteries, constricted veins, and delicate walls, each motion induces transient circulation dips. Include low evening fluids, reduced oxygen, or pressure concerns, and risk soars. But more startling is emerging insight. Frequent sleep motion may not merely stem from unrest. It may represent brain striving for equilibrium. Permit me to share Mrs. Nancy Delgado's account, a 76-year-old former piano instructor from Colorado. Ever astute, graceful, meticulous, the type who still pressed her pillowcases. But months prior, Nancy awoke fatigued, despite presumed 7-hour sleep. Her spouse noted constant bed fidgeting, side to side every 10 to 15 minutes. Initially, they deemed it aging. Then, headaches, dawn vertigo emerged. One night, she roused with right hand numb and speech impaired. In ER, scans showed small ischemic stroke, probably hours pre-awakening. An origin? Sleep analysis and vascular imaging indicated poor sleep quality plus intermittent hypoperfusion, brief brain flow reductions during restless shifts. Over time, unstable circulation caused neck vessel pooling and eventual clot formation. These clots arose not from cholesterol or cardiac issues. They stemmed from disrupted, unstable sleep. The variety, deceiving you into believing rest while brain endures assault. Nancy's narrative is more prevalent than assumed, and for elderly, fragmented sleep presents multiple dangers. It hinders blood pressure stabilization as normal deep sleep reduces BP controllably for healing. It sustains high cortisol, potentially causing overnight pressure surges, a prime morning stroke catalyst. It interferes with lymphatic system, brain's innate cleanup, yielding chronic vascular swelling. And it generates ongoing cerebral perfusion variances, the pressure-sustaining capillary flow. These aren't mere terms, they're initial alerts, and body has signaled them nocturnally. Awakening sweat-soaked, gasping, or heart pounding. That's brain distress call. Hand tingling, unsteadiness, or morning stiff neck. These aren't mere age annoyances. They may be body's plea for improved sleep setup, fluids, circulation. So, what to do? Treat agitation as indicator, not custom. Shun late caffeine or spirits. Keep room chill and dim, but layer light sheets over heavy. Use body pillow to support joints and curb involuntary jerks. And crucially, consult physician for sleep study if you or partner observe frequent arousals or excessive bed motion. Nancy now uses soft cervical pillow, bedside water, and pre-bed slow breaths. Recovery progresses gradually, but she shares, "I once viewed morning fatigue as standard. I failed to see it as ignored nightly warning." And she's correct, for when sleep turns combative, body retains it. But another covert peril collaborates with poor sleep, and it's frequently neglected as it precedes bedtime. It initiates when you omit or deliberately bypass something vital, a medication serving, a tiny tablet, a basic regimen. That could be the sole barrier between you and transformative stroke. Let's discuss skipping heart or pressure meds pre-bed. If you're still viewing and valuing these revelations, kindly post number 1 below to affirm presence. Now, let's continue to point number 7. 7. Sleeping after skipping blood pressure or heart medication. For numerous elderly, daily pill routine turns automatic until the evening arrives when you overlook. Or perhaps you feel well and assure yourself once won't count. Maybe containers vacant, or you're weary or concerned over effects, and thus you omit that small tablet intended to manage pressure or steady heartbeat. What you might not comprehend is a single omitted serving, particularly pre-slumber, can evolve into undetected hazard during rest. And for seniors, this hazard can manifest as irreversible event, a stroke preceding dawn sans any caution. Allow me to clarify why. Blood pressure adheres to innate cycle, ascending mornings and descending nights. This decline resets body. But with hypertension, atrial fibrillation, or cardiovascular ailment, body regulates rhythm poorly independently. That's medication's role, sustaining steadiness when system falters. But omitting evening serving, especially beta blocker, calcium channel blocker, ACE inhibitor, or anticoagulant, triggers alarm. Pressure may surge nocturnally, often 2 a.m. to 6 a.m., peak stroke hours. Heart may accelerate or irregularize, and if vessels already constrict from age, cholesterol, inflammation, that abrupt pressure rise can induce blood pooling, stagnation, clot generation. Clots not remaining dormant long. Permit me to recount Mr. Harold Green, 72-year-old former electrician from Wisconsin. Health conscious, he strolled, ate wisely, never smoked. Mild hypertension prompted nightly low-dose med. One evening, viewing sports, distracted, he forgot pill. He dismissed it as minor, planning morning intake, but opportunity missed. Next day, Harold awoke oddly. Wife noted facial change. Speech attempt failed. Within hour, hospitalized with moderate ischemic stroke. Physicians located small clot in left brain hemisphere, likely formed early morning amid unchecked pressure rise from omitted med. Worst aspect, Harold unaware risk so prompt. Assumed single skip harmless. But in elderly with less elastic arteries and age-thickened blood, it tips balance. Physiologically, meds ease heart and vessel strain. Omission removes safeguard. Pressure accumulates, artery lining irritates. Platelets activate for clotting. Where pressure and turbulence exist, clot probable. In seniors, error tolerance minimal. One skipped pill differentiates stable night from life-altering morning. Harold recovers via therapy, but adheres strictly now. No variances. Pocket pill alert. And at follow-up, he stated, "One night robbed my speech. Won't permit further loss." If you use pressure or heart meds, even low-dose aspirin or thinners, ingest consistently. Set alerts. Request loved one verification. Bedside organizer backup. Because at life's this phase, brain depends on routine beyond memory. And recall, not just actions protect. Omissions, even singular, can unravel years' diligence. But suppose peril stems not internally, but from surrounding space? From chill air grazing neck during sleep, from absent head support below. What occurs in cooled rooms sans proper neck aid? You might be astonished at swift brain impact. And unrelated to ease, allow me to demonstrate. 8. Sleeping in cold rooms without proper neck support. We frequently link cool nights to superior sleep. That fresh air, chilled linens, body coiling into blanket warmth. Many deem it invigorating. Numerous seniors lower thermostat, thinking healthier or cost-saving. But suppose that cool room, paired with inadequate neck aid, exceeded shivering? Suppose it covertly limited brain blood supply, constricted arteries, heightened stroke risk during slumber. Most elderly unaware, but sleep temperature and posture profoundly influence vascular network. With age, body regulates heat less efficiently, especially nocturnally. Cold prompts vasoconstriction, vessel narrowing. Most hazardous in neck, where carotid and vertebral arteries deliver oxygen-rich blood to brain. Now, envision neck mildly misaligned on soft pillow or unsupported. That slight improper bend plus cold vasoconstriction diminishes brain blood flow. In aged form with stiffened vessels and sluggish circulation, this forges lethal mix. Restricted movement, blood accumulation, clot development. Permit me to share Miss Loretta Dixon's story. 78-year-old former nurse from Montana. As keen as ever, brimming with tales and humor. Preferred cool bedroom, window ajar even winter. Custom. Curl tightly, neck mildly chin-tucked on flat pillow. Deemed normal, healthy. Then one morning, atypical awakening. Sun found semi-alert, unfocused eyes. Slurred speech, unable independent sitting. Hospital scans showed brainstem stroke, hazardous type, from clot in posterior circulation fed by vertebral arteries along spine and neck. No cardiac disease, no smoking history, no omitted med. But likely cause, chronic neck squeeze and cold-induced vasospasm during sleep. Over time, these reduced flow enough for clot, traveling to brain's most fragile zone. Loretta now in therapy. Assisted walking, swallowing difficulty, stark reminder minor oversights alter lives overnight. Cold tightens vessels. Inadequate neck aid misaligns them. Combined, they subtly deprive brain oxygen, particularly morning pressure spike. If underoxygenated and constricted, small clot devastates. And another overlooked fact? Many seniors have cervical spondylosis, age neck spine changes. Paired with poor pillow in cold room, brain flow risk surges dramatically. So what to undertake? Keep room cool, not frigid. Ideal elderly sleep temp 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius. Ensure proper neck support. Medium firm pillow aligning head with spine, not downward angled or side turned. Shun chin to chest or head cocked sleeping. These minor tweaks seem trivial, but protective acts, nourishing brain during sleep. Loretta recently shared, "Never imagined simple cold pillow could harm brain, just unaware." And that's most terrifying. So many seniors unaware. They follow natural feel, years custom. Oblivious aging body follows new rules. But occasionally, peril not in sleep stance. It's in pre-eye close action. Because final custom most misconstrued. What befalls bedding post-heavy meal or excess glass. How alcohol or late digestion impacts heart, pressure, brain during rest. Allow me to guide you, as this final could be concealed trigger toppling all. 9. Sleeping immediately after heavy drinking or big meal. A widespread notion we retain into later years. Full stomach and wine aid sleep. That warmth, solace, day-end wind down with substantial supper and nightcap. Ritual in many U.S. homes. But as neurologist, I must reveal unheard fact. Bedding right after heavy meal or alcohol may covertly ignite stroke-type stripping all. Speech, memory, autonomy, pre-awareness. Aging body handles food, alcohol, stress far differently now. Former comfort, now silent peril. Late, large fatty meal, sodium sugar rich, overworks digestion. Blood diverts from brain to gut. This cerebral circulation drop may seem minor, but with age-narrowed arteries, repercussions notable. Add alcohol, perfect storm forms. Alcohol, initial vasodilator, widens vessels, hence face flush or drowsiness post-drink. But as fades, vessels abruptly narrow. Pressure surges, heart labors for stability. In elderly, this shift prompts arrhythmias, pressure oscillations, poor brain oxygen. All subtly elevate stroke risk, especially vulnerable sleep. Permit me to recount Mr. Gerald Thompson, 74-year-old former farmer from Nebraska. Disciplined, sturdy. Gerald's joy? Evening ritual. Dinner 7, bourbon 8, bed 8:30. One winter eve, holiday feast indulgence. Turkey, potatoes, gravy, pie, usual drink. Felt content, proud. But that night altered. Around 4 a.m., wife awoke to cold, unresponsive him. ERCT showed massive ischemic stroke in frontal lobe from night-form traveling clot. No atrial fibrillation, no infection, no skipped med. Found. Post-meal high triglycerides, dehydrated blood, alcohol rebound constriction. That mix reduced brain circulation long enough for quiet, fatal clot. Gerald endured, but stroke took speech. Wife, full caregiver, tearfully shared, thought all correct, unaware dinner, drink could separate us. Truth, digestion, alcohol vie with brain for resources. Post-60, digestion slows, food lingers stomach, diverting brain blood hours. Alcohol dehydrates blood, disrupts heart rhythm. Together, unstable pressure, clot encouragement, reduced cerebral perfusion, especially cortisol morning surge when strokes peak. If drinking, moderate, earlier ideally. Full meal, wait 2 to 3 hours pre-lying. Water with dinner. Shun late, salty, greasy, sugary. Don't confuse drowsiness with sound sleep. Alcohol, sleep fragmented, brain disruptive. Not about foregoing food, drink enjoyment, about honoring body needs now. You've toiled for good life. Don't let dinner routine dismantle it. Because stroke threat, not always painful/warned, sometimes quiet, comfort-wrapped, routine disguised. And now, having exposed 9 riskiest sleeping customs potentially elevating overnight stroke risk, you might ponder, what constitutes secure sleep? What alters starting tonight? Not just better sleep, but long-term brain safeguard. Let's consolidate. I'll guide through healing, not harming habits, because prevention starts with awareness. Change, power with you. Final wake-up call. Sleep isn't mere rest. It's safeguard. If you've reached here, thank you. Not just for perusing, but for valuing truth on sleep's subtle brain health shaping. Learned content, not fear-based. It's empowering. Power from awareness, knowing internal happenings while world slumbers. At life's this stage, knowledge not just useful, protective. Every now choice, however minor, weighs more than decades ago. We've traversed 9 undetected customs seeming innocuous. Comfort stances, familiar routines, pain/fatigue decisions. But each potentially gradually nudges brain toward peril. Flat sans pillow, prone in recliner, heavy blanket under, favored arm on, nightly tossing, med skip, cold sans neck aid, full belly/alcohol bed. Each over time forges blood stagnation, thickening, clotting conditions. And an age-facing body, stiffened arteries, slower flow, less oxygen, these clots not just possible, probable. But crucial doctor truth, most sleep strokes preventable. Let's sink in. Not inevitable, not random, often unquestioned routine results, ignored body signals, outdated comfort customs. So if one message to retain, this: control remains. Capacity to alter sleep, brain care, tomorrow protection persists. Because sleep, not just rest. Sleep restores brain flow, clears toxins, balances hormones, readies for day. Sleep when brain most susceptible, but also most receptive to healing, if permitted. Commence tonight. Mild head elevation, left side if possible. Neck support. Shun late drinks, heavy meals. Meds unfailingly. Breathable bedding, hydrate. Craft sleep area honoring lived years, desired life enjoyment. Not drastic shifts, subtle but weighty. In uncontrollable world, this health aspect where nightly decisions count. Not too aged for change, not too advanced to self-protect. Never too late to learn wise sleeping. Not just comfort, survival. As I tell patients, not sleep duration, but wisdom matters. So tonight, drawing covers, head down, query. Does my sleep aid or harm brain? Because sleep protection safeguards all. Speech, memory, balance, autonomy, essence of self. Always worthwhile. These lessons inspire full, authentic living. Now, I'd appreciate your input. Pause, reflect, share one learned item and life application plan. Let's mutually support this truth-embracing path. If video pleased, comment 1. If not, 0, welcome. Feedback valued. Remember, like, share, subscribe YouTube for similar. Thank you viewing to life on your terms.